I'm Andrea Flores. It might feel like life is getting back to normal as more businesses and activities open, but COVID-19 is still top of mind for many of us. That's why every week we get your coronavirus question answered during a special segment called Q&A with Dr. Dave. Joining me now is CBS4 Medical Editor Dr. Hnida. And Dr. Dave, the past few days, the United States has been setting some records for the number of coronavirus cases. Colorado is also starting to see another increase in cases. Do you think things might be reopening too fast?
Well, I think when you look at Colorado, I don't think we can say that we are reopening too quickly. I think when you do look at the surrounding states, I think those are situations where they did try to open a little too quickly. Here in our state, what we're seeing is an uptake or an uptick in cases. And that makes us a little bit nervous. Now, normally you would expect to see a little bit of rise in the case numbers as you begin to reopen more and more. But at this point in time, the pattern is that the rise is becoming a little bit more steady. And so the one thing we don't want to see here is what's happening elsewhere in other places. I think that when you look at other states such as Arizona, Texas, Florida, and so forth, they've had an explosion of cases and also an explosion of hospitalizations, and also death rates are going up as well. Fortunately, we have not seen hospitalizations or death rates go up in our state, but the state health department are watching these numbers very, very closely. Now, the importance of this is the fact that we've really come quite a long way than where we were a month, 2 months ago, and we don't want to go backwards. And if we continue to see this gradual, slowly increasing number of cases in our state, we're going to wind up going backwards. So I think at this point in time, as you look at this picture as a citizen of Colorado, particularly if you're a younger person, because that's where we're seeing the greatest rise in cases, is the fact that with these increased lifting of restrictions, so to speak, there also comes more personal responsibility. We need to be ever the more vigilant, and we really need to be really following the guidelines even stricter than what we were doing weeks and months ago. We need to be able to continue to reopen our state, and we would rather not have the rug pulled out because we all of a sudden begin to show a situation like Texas or Arizona or Florida. So enjoy, for example, the upcoming 4th of July weekend. But remember, personal responsibility, personal behavior is really what you need to be thinking about during these times, or else we will wind up going backwards.
With summer here and the 4th of July this weekend, how can we have a picnic or throw a barbecue with a little less risk?
Well, I think the big thing is you always have to realize the risk is never zero. But I think if you exercise proper precautions, you can get together with folks and enjoy a good picnic or perhaps a barbecue at your home. I think everyone needs to follow the basics, and that includes wearing a mask, social distancing, as well as good hygiene. I think that you need to limit the number of people that you are congregating with. You also need to do it outdoors. Those are very, very helpful. Let's say that you're having a picnic. I think if everyone brings their own food, their own silverware or utensils and plates, you're in good shape there. No share food. In other words, no communal chips and dips. Let's say you're having something at your home. If you decide you're going to barbecue, really what you need to do is designate one particular person to help get that food out. For example, if something's coming off of the grill, one person is in charge of doing that. If it comes to other sort of side dishes, one person is involved in that, so you don't have a bunch of people congregating around and helping themselves. I think if you do follow a few simple guidelines, you can get together safely and enjoy this weekend as well as the rest of the summer.
And coronavirus is affecting pregnant women more than originally thought. What kind of precautions do you recommend for women who might be expecting?
This is something that just came off of a new study where they found that women who are pregnant are not so much more likely to develop COVID, but if they do, they tend to get more severe disease. In other words, they wind up in the hospital more frequently, they wind up in intensive care more frequently, and wind up on a ventilator more frequently. So it actually becomes more of a higher risk condition for COVID. And so I think that when you look at what happens during pregnancy, it actually does make a little bit of sense of what's going on. Because you are carrying a child, your immune system winds up being depressed somewhat. So your immune system isn't functioning as well as it could. And then when you think about it, as a pregnancy winds up progressing, child gets bigger, your lungs literally get compressed. Your lung capacity goes down, so you're not able to get that full breathing capacity. I think the bottom line in the advice here is the fact that, well, okay, we are aware of this. We'd like you to be aware of this, and I think it's time to maybe take the precautions up an extra notch as you go through a pregnancy. And if you're able to do so, you should wind up doing well. But I think it just is an important heads up that it is something you need to be extra aware of.
Dr. Dave, thank you as always for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit CBSDenver.com. We'll be right back.